Good afternoon, everybody, and welcome to all our guests sitting in the back. And apologies for Mayor Tracy will be coming in on Teams for the meeting today. She's not particularly well, as is Kerry Sutherland will be on Teams as well. So I'd like to open the meeting with a prayer. God of wisdom and justice, as we approach the elections, we pause in gratitude for the freedom we have in this country to choose our leaders. Thank you for the gift of democracy and for the voice of all who participate with hope for a better future. Grant the new council clarity as they discern the issues with courage to seek the common good over personal gain and the compassion to consider the needs of the vulnerable and the voiceless. Help them to be swayed by fear, falsehood or division, but instead to be guided by integrity, truth and a deep desire for peace and justice. Bless all the candidates. May they lead with humility and purpose. We pray to protect our nation from discord, violence and injustice, and may your wisdom guide not only our votes, but our actions beyond the ballot box. Unite us in our diversity and remind all candidates that the highest calling is to love and protect your neighbour, to serve with dignity and grace, respecting all others, while walking humbly beside you. We ask this in the name of your Son, Jesus Christ, and through the power of the Holy Spirit. Amen. Right. Okay, so we have two via Teams apologies. Are there any further apologies? No, there being none. Could somebody please move the apologies be accepted? Councillor Sharon, Councillor Mike, thank you. All those in favour, please say aye. Against? Carried. Sorry, people. I'll bring that back up again. Right, we have two presenters in public forum today. The first presentation will be from Cheryl Hawara from the Tararua Health Group. So if you would like to come forward to the table, Cheryl, when you speak, you turn the microphone on, and I must remember to turn mine off, otherwise you can't be heard on the live stream.
I noticed you've got a few other chairs. Can I bring my tea?
Yes, of course you can. Yes, absolutely.
We'll take up. Take over.
Excellent. Thank you.
Are we on? Cool. Ngā mihi nui ki a koutou katoa, nau mai. I just want to introduce myself. Ko Ruahini Te Maunga, ko Manawatu Te Awa, ko Rangi Tāne, Te Iwi, ko Ngāti Pakapaka Te Hapu, ko Kaituki Te Marae, ko Rangi Whakeewa Te Tangata. Kia ora koutou, ko Cheryl Hoira ahau. As Alison has said, thank you for the kind invitation, Alison, to this hui today. It's really good to see you, and I think it's your last one, isn't it? Kia ora. Thank you for the service that you've provided to our region through the years that you've actually been here diligently working, and I've been to a few with you in my different roles that I've done in the past. Today I am not going to be doing a presentation on screen because I've brought my presentation with me, and that's our leadership team, our management team from Tararua Health Group, and we'll each be giving a mihi on who we are and then a wee piece of what we do for Tararua Health Group, and we will open the floor to you all to ask any questions. Kia ora. So first of all, we've got Michelle. Switch on.
Oh, I can't speak.
Kia ora. I'm Michelle Wilson. I'm the clinical manager at Tararua Health Group. I've know a lot of your faces. I've been to a few different meetings. So we're very lucky to have Cheryl on board now as our general manager. So
just basically here to say hello and who we are. We're developing, changing strategies moving forward at Taurua Health Group.
Kia ora, my name's Cherry Ann Lee. I'm hospital manager at Dunedin Hospital, and I, like the rest of the leadership team, sit under Cheryl as well. And I've been in this position for 6 months, and it's been quite the learning curve. I've been at the hospital since 2010, so I've been part of the community for some time. In fact, even had my time with Sharon. So it's a great community, and I'm obviously here to, to sort of bring together what the community needs and, integrate that within the hospital. It's definitely exciting times looking at ways that we can bring more services to the area and what people actually need and what they're going to get the biggest gain out of. So yeah, we're looking at lots of different services coming back on board, which should be really, really good. So thank you.
Kia ora, Cherry.
This one's working. Is it working?
But you're not up there.
Ah.
You're going to have to go and stand over there, Peter.
Kia ora, my name's Peter. I'm new in this place. I'm 3 weeks into the job. I come from, so I'm the practice nursing manager. So I have come here, I've been here for 3 weeks. I come from an extensive medical background, been nursing for 35 years. So yeah, bring a lot of clinical knowledge into into Taurua healthcare. So yeah, as I say, 3 weeks, so I'm just learning the whole role. So yeah, and it's good to be here.
Thanks, Peter. Peter is actually our practice manager at Broad Street.
Good morning. My name's Robin McDougall, and not that it's any competition, but I've been here, or had an association with Danny Burke since about 2014, I think, Sharon. So Sharon and I go way back. However, I don't whakapapa to Danny Burke. My husband does. So we are a McDougall family that, I am now part of that family, but my husband lived here for many years with his father, Fred. I don't know whether that makes any sense to you, but from a farming community. So down to the business, and mine is maternity. I manage the maternity department, and we have a wonderful team of midwives that try to give your community a pretty good service. And that is one of the services that will never, ever really change, and there'll always be a need for that. And so we are hoping to bring that service out into the community and make us a little bit more publicly profiled, socialise our service. The other service that I manage at present is the radiology service. And it is growing, and we're trying to grow that so that we have more capacity. And I'm sure you know there's a national shortage of sonographers. So we're competing with 380 odd other job advertisings on Seek. But we will be hopefully going to manage something around that. But we are trying very hard to provide that for the community. We'll also have a Saturday clinic for x-rays as well. But so that's me, and for all my sins, I've come to see you today and answer any questions.
Right, so I guess during, I'm not quite sure that you all know, the history and my working experience that I've had within Hauora. So I've been in-house for about 30 plus years, and 10 years with central government, working in Parliament. So during my journey of working across this country, I have been able to work alongside significant teams to capture the voice of our communities. And included in there was coming back home to collect the voice of our community here, Tararua, around what our people here look and see as the needs for better services for Hauora within our regions. The most recent piece of work that I was party to was working alongside what is our Iwi Māori Partnership Board in developing a community health plan. So we worked alongside, I was a member of that Iwi Māori Partnership Board, and we worked with the iwi here, Rangitane and Kahungunu, to look at capturing the voice of whānau Māori. We worked within the communities to look at capturing the voice of our whole of that community. So another piece of work that we did, so there is a community health plan that sits on the Iwi Māori Partnership Board, which is Te Pai Oranga o Ruahine o Tararua's website. And I think if you're, as a council, and I know you're going through these elections at the moment, I would suggest that each of you who are sitting for council take a look at that website, take a look at the findings, the data, the statistics that were gathered, particularly for this Tararua region, and equip yourself with what the people have said that they see as a necessity for the region, and be prepared and ready to be answering questions around how we see you as councillors going forward serving our people here in our district. There were some significant findings from that piece of work that was done, and the data that had been collected through a collective in order for us to be able to come back and then make decisions on what was needed to be put in place when we look at Hauora for the Tararua region. Another piece of work that I worked on, and that was alongside Robin here as well, was looking at the 1,000 days of our babies, mothers and babies, and we were able to work to capture the voice of our of that community. And that's not just looking at mothers and the husbands, it was looking at caregivers. So caregivers, of course, we all know, also includes those that are looking after those babies, not always necessarily the parents. So we were able to gather the voice of that community within this community to be able to then look at how do we strategise when we hear the voice of our communities to be able to implement what they're actually saying that are needed here. One of the pieces of work that came out of that, which I was so proud that Robin had implemented directly and straight away, was lactation services. So people, and that piece of work was done through Mid Central Health. They contracted me in to lead that for them. And so that sits there as a piece of the voice of this community around how do we deliver for our babies. Another piece of work that I worked on with providers from this community was for Te Aho o Te Kahu, which is the National Cancer Control Agency, which sat under Dai Safety at the time, and that was to look at services around cancer delivery and the voice of our communities. What does that look like? What services do they think need to be coming back into the Tararua region? Coming home, I got a call from the Mayor, Tracy. Thank you, Trace. I acknowledge you that you're online and you're Māwiwi. But I did get a call from Trace to come home and help. So coming back to Dannyvert meant that I was able to come back and have an understanding of the key priorities that were raised by this community around what services needed to come back within the Tararua region. I started my journey at the Dannyvert Hospital, and I was 16 actually, not that long ago. And then they closed our hospital down, and we all knew what happened from that. So to be able to utilise the voice of our people of this community, our whānau, to be able to come back and then look at, in this particular role that I now hold under the Tararua Health Group, we have the pleasure of being able to have our hospital service there. We have 6 beds that are funded by Te Whatuora, Mid-Central. They have plans in place across Te Whatuora at a national level to look at bringing services back into our community. I'm rapt to be in a place where I can actually identify what people of this community have said they need, to be able to look at what services Mid-Central can release to us, well, Palmerston North Hospital. So we have been doing some significant work with Palmerston North Hospital at looking at some of those services. So one of those services, of course, is we have renal patients that travel over 3 times a week that live here and to undergo services over there. We've been working alongside, Cherry Ann and I have been working alongside Palmerston North Hospital specialist care over there, their unit, to look at bringing those services back here. So we would implement 2 chairs for self-management of those patients, that they don't have to be travelling over there 3 times a week. So we're looking at bringing those services back here. We're also been working alongside the cardiology governance group for Te Whatuora, Think Hauora, at looking at bringing cardiology services back to our region as well. We're in a place where we have 2 cardiology specialist nurses that actually work for us that would be able to take up that mantle. So we are doing some significant work with Mid-Central to bring services home. What else are we doing, team? We've been able to, and you would understand as politicians, that it is really hard across this country at the moment to recruit, maintain practitioners, medical practitioners, doctors, nurse practitioners, midwives. And so I guess coming to you today, it's not only just coming to you to let you know what we're doing and you asking us questions. I'm going to bring a challenge to you today and ask that you support us in the work that we're doing around bringing services back to our community, ensuring that we have the means to be able to not only just recruit but maintain professionals within our rural community. It's really hard for urban areas to recruit and maintain doctors, even more so for our rural communities. And now we have 3 services that you're all aware of that are here in the region. We have lost significantly a large amount of those patients that we once had. And I guess it's about, for us as a team, we're a relatively young team that have been forming together. And I'm very proud of this team that have come before you today. They're well versed in the roles that they play. They're well skilled, experienced, and it's a privilege to be able to bring them before you today. We so I just guess I just wanted to come and say to you, we look forward to having your support, council, and for those new councillors that get in, you know where we are. Come see us. We have an open door, and more than happy to be coming back and answering any other questions that you might have of us. So ask your questions now while you've got the opportunity to do so. Kia ora.
Thanks very much for that. That was a really interesting update, and it's quite exciting to see that, that desire to get as much back in-house as possible. So we'll take questions. Councillor Scott.
Thanks very much, Chair Allison, and I have a couple of questions, if that's okay. And Cheryl, really lovely to see you again. I had the privilege of hearing a similar update recently, so thank you to you and to your whole team for coming, and really grateful. My first question is, it is really encouraging, and I'm definitely very supportive of bringing more services back. But I did want to just double check on the current services, particularly being operated by the hospital. Is there any plans to change any of the current services that are already in place? And I have heard a couple of things in the community, and I just wanted to check with you, because if that's incorrect, it's a good opportunity to set that straight. So the current services that we've got, are we looking at absolutely keeping those in the hospital?
I can answer that if you like. Sorry, Robin.
I'll go back to my chair.
Yes, so that's that's a good question, and no, there's no changes at all. We still have 8 beds, which are recently full. We've been running at full capacity more often than not. We still see a wide range of different things coming through. So we have anything from palliative respite to fractures to, diabetes actually has been a big one coming back from Palmy. Just, obviously as a primary unit, we try and work really well in with Palmerston. We've got a good communication going on with them now about getting people back to our area that want to be back closer to family. There's no changes other than the fact that we want to create more of an integrated hub and the acute care clinic that we would like to get up and running ASAP as well. So, yeah.
I think, Scott, what you're talking about is it those beds?
Yeah.
Mid-central beds? Right. Okay, so the mid-central beds, of course, is one of the largest contracts that is held with Tararua House Group, and you would understand that. They are looking at some changes to the way that those beds are currently being serviced. And there is, across this country, you would have heard about the 146 million, and Dannevirke was mentioned. So they are looking at some changes to the way that funding that they provide will look like in the future. Now, we're not sure about how far in the future that might be. So for now, we will have no changes until that, and they call it integrated community hub model, right? And that still is not been, completely put in solid. But if that does happen and they are wanting change, then change will have to happen. But we have had some discussions with our own doctors around those beds, and they would like to see, significantly those beds remain. We have had some discussions again with what that might look like with Te Whatu Ora. We're in discussions with them still. We've had 2 meetings with them around those beds. We would also like to ensure that we've got beds there for our community. However, when they do decide to make that change, then we would ensure that we can keep some of those beds. 2 of those beds don't belong to them. 2 of them are ACC beds that we hold, so they will definitely be there. But they were looking at more so day beds. Yeah. We have had, some discussions around that, what that might look like when they become day beds. Yeah, but we definitely will remain to have some beds there. We've got palliative patients that we want to ensure that we are able to accommodate for them. Yeah, so those are still discussions that are only in place now. As soon as we have more solid information about that, what might look like, we'll definitely come back and report that back into the council. Yeah.
All right, we might be on now. I just wanted to reiterate that maternity will not be affected by this new commissioning proposal, and the maternity service will remain as it is, and those maternity beds for postnatal stay for birthing will definitely remain.
Perfect, thank you. Thanks very much for that, and appreciate the detail around, and certainly there's some uncertainty, and I think we, of all people, can certainly understand that. I want to circle back, I guess, to where I sort of started with my question of the extra services that you're talking about, and that's particularly exciting. And Cheryl, you issued a challenge to us, and I'm glad that you did, knowing that unfortunately local government's influence can be somewhat limited at times. I'd be really keen to get an understanding, because I'm certainly up, and I'm sure most would be, for taking that challenge up. But what would that support look like practically to you? What would you like to see this council do to support bringing more services back into the district?
All right. Okay, I think it's about having a clear understanding as councillors around what the people of this community are actually asking of you as politicians, local politicians, and in particular around your portfolios, working alongside. For me, it's looking at Te Taio, which is our environment, right, and that's which you work within. So we have a lot of, when we work within the health, it's looking at the external factors that do affect our people, and when we have patients that present, and I think particularly around respiratory, and a lot of that is affected by the environmental stuff in which you all work. We have oral health, which when you're making decisions around fluorides and that you keep into consideration that we are there, that we can be there for you as advisors when you are going to make those decisions around health for our people. And as much as before us, of course, is the fact that we have iwi within this place, and to take into factor as well. But we do have clinicians who can provide advice around those decisions when you're making those. Yeah. It is a hard one when you think about the role that you play as local government. But to know that we have a local government that is there not just to keep us accountable, but that we can also come to you and provide you advice on how that might look for us as well. Yeah, as key players for this region and health.
Thanks very much, Chair Alison, and thanks for that, Cheryl. I suppose, and it can be challenging with some of the scope limitations, some of those becoming even more reduced shortly. Would advocacy play a part in that? So is there, and just wondering how we could coordinate that as a council?
Absolutely. I think we are very rural. We are in great competition to get clinicians to this very rural region, more so that they're very few across this country at the moment. We have clinicians that we've had to source from overseas. We have immigration restrictions on bringing in clinicians around being able to have them come in to practice. We definitely have staff who are coming on board with us that would be better suited to be we have one coming on board actually. He's actually a doctor/surgeon, but coming into a significantly lower role, or I wouldn't say lower, sorry, coming into a significantly other role, because he cannot practice here in Aotearoa, New Zealand. So definitely we will work beside him to try and get that where he can practice. But it would be really helpful if we were able to gather support from our council to ensure, through advocacy, that we can get these practitioners into the country. Yeah, and that they can practice.
Is it going to? Yeah. Just in a simple frame as well, when we do get our clinicians coming, sometimes they're just here for a short time, sometimes they're a bit longer, is just inclusive. Maybe it's just including them at a squash game or different things like that. So I don't know exactly how we get that out there, who we've got at the time, but it is useful to really make them part of the community so they want to be here forever.
That's a good point. We have Dr. Robin Sebastian, who's here with us. She started with us June, and she's here till December. And we've been looking at, she's looking at activities to do. But I think that would be really nice too, if we could bring them to a council meeting so that they can get to know who you are as a committee and as the people who represent us. To make them feel welcome. Yeah, that would be a simple thing for us to be able to do. Who knows, they might decide they love you all so much they're going to stay. So
I just wanted to add some thanks to Tracy, who actually helped us last year to try and navigate a critical midwifery shortage that we probably still have, I'd have to say, and we also have a sonographer shortage, which hugely impacts our day-to-day provision of service. However, you have all had attention to Haora Tai Whenua and attending that platform, and it's a voice to Parliament, so we hope to have your continued support to do that. And I know Tracy and I have together been at one of those sessions, but it's really important to continue batting on that door at Parliament level around recruitment for significant professionals. Thank you.
I guess just in closing, not that I'm shutting you all off, but you do have another speaker. I just wanted to say thank you to you all as well. When I was on the other side with Te Whatu Ora, my colleague and I were looking at closing the radiology because it didn't appear to be utilised as well as it should have been. We were then met with a very strong message from the Mayor and councillors and MPs about leaving that radiology alone. So I want to say thank you for your strong advocacy, because it is one of the most amazing pieces of one of the units that we've now been able to work, thankfully, to Robin and her team to revive it and to bring it back to being a very strong contender to support the services, not just at THG, but across the whole of this region. So I want to say thank you to you, Tracy, and to the team for fighting against myself and my colleague over at Te Whatu Ora, telling us to leave it alone, because I've now got it today. So, and our team are surely very grateful, and I know this community will be. So we do have the radiology service there, and Robin is working very, very well to be able to look at weekend services as well around that radiology department.
Thank you. I'll take Councillor Sharon, then Councillor Mike, and then we'll wind this up. Thank you.
Kia ora, Cheryl. Thanks very much to you and the team for coming in. It's always really important that we are kept up to date with what is happening. Just a couple of points before I get to my question. TDC is a member of Hauora Tai Whenua, and I'm an individual member as well. So one of the events that you would have attended with Mayor Tracy, I was at just last month. So the voice is a loud one. There were 2 members from Tararua in that room with Simeon Brown and a whole raft of coalition ministers all wanting to hear what the issues were. And oddly enough, the issues are still the same as they were 20, 30 years ago. So, so I acknowledge we are here, we are advocating. It might not be, on a daily basis, but every opportunity we take to push the message. I just have 2 questions. A strategic one. Given Omni's networking and ability to bring in health professionals, I appreciate that that's a struggle. The last time Tracy and I met with Mark, he was indicating it was pretty tough at the top there. So, but given that we've had 2 other practices establish themselves, from a sustainability point of view, have you had to consider reorganising or restructuring to be able to rejiggle where the departments and the services lie because of the changes that you've had? And how is Omni supporting you to do that?
Absolutely. Omni are definitely very strong at backing, have been very strong at backing and still are backing me and the changes that are required around being able to recruit. It's no secret in the town, and some of you may not know, but we have lost 3,000 patients. So in losing 3,000 patients has meant that we've not been able to continue to maintain the same level of workforce that was currently in place. So we are at this stage going through an FTE management process at looking at what can we continue to, and it's one of the worst things that any manager wants to do, because the people that we have are local people, not just local people, but are local people that are my friends, that I know, that I went to school with. And so coming home and having to go through this process has been one of the most difficult for myself and our team. But it's necessary. Unfortunately, it's something that we have to do in order for us to be able to survive in this current environment. That is not an Omni decision that needs to be made. That's a community decision, and one that we've had to be forced to face. So we are currently going through that, through a process. We have looked at how do we ensure that we can recruit and keep clinicians on board, because that's our whole focus, is to ensure we've got doctors, that we've got nurse practitioners, we've got a team that can service the best service for this community. And it's not about going through this process with the other 2 practices. In some ways, I am extremely grateful for, it's not always good to lose capitation, because that's what keeps us functioning right. But really it's about looking at the quality of a service and the quality of a service of what we can provide with the current workforce that we have. We've been fortunate to have been able to, since I started, we've had 2 doctors come on board. We've had Kumaran, who just this community loves. He's come back from overseas. We've got him in place. We have brought in Dr. Robin Sebastian from America. We have ED nurse practitioners that have been working in Paiatua and doing some walk-in clinics, some template work. I have a nurse practitioner who has come on board just on Friday, and she's doing the rest homes for us. So I'm currently working through a contract with a fellow who's going to be coming on board with us. He will be doing 2 days in Paiatua, 2 days in Broad Street. And I'm also working on a contract at the moment with a nurse practitioner who is 20 years ED. So the word is out there that, you know, and this is in regards to the incredible work from this management team that sit here at this table with me today. We've been able to, you would know from the teams that had separated and gone off, that it was a hard time. It was extremely hard coming in and having to ensure this community that we are not closing down. We are not going anywhere, people. We are here. So this team are here with me today because we are standing to say that we are going to work very hard for this community to ensure you've got a quality service. Yeah.
Thank you for that.
Thank you, Sharon and Cheryl. Mike. 2 questions. Okay.
Thank you, Chair. In light of the reply that you gave Councillor Sharon here, you don't have to answer the question. My question was just going to be, how many vacancies are in Tararua Health Group at this point? Thank you.
We have, I can let you know what doctors, how many practitioners we have on board. That might be better suited for answering your question. We have in the Broad Street Clinic, Dr. Kumaran, Dr. Robin Sebastian, Dr. James, and we have Marta Crew at our hospital. So we've got 4 general practitioners there. We have Eloise, who is a nurse practitioner. We are looking at bringing in the fellow who will start in November. We have Dr. Juliana online. So we have now thankfully to COVID, COVID has helped us all to move into the space of being able to have services online, right? So we have telehealth, and there we have Dr. Juliana, who is our online telehealth practitioner. She's a fellow, and she has been able to provide for us same-day appointments for patients. And we also have Dr. Chris, who sits over in Paiatua. But over in Paiatua, we also have 3 nurse practitioners, that sit over there. So we are starting to get, quite a great team coming on board. And that is good because the word gets out. Yeah.
Just to tack on to that, we've got nurse prescribers, a couple of nurse prescribers over at the moment doing training. One's just about signed off for that, and we've got another one that's in training and will be signed off by the end of the year. And we've got community nurse prescribers, a couple of those go up and going as well. So you'll see more different faces over within the practices as well.
One of our doctors at the moment is going through his fellowship training as well. So he's completing his training as a fellow. And we have another one who is looking towards doing the same, which we support the training of the staff.
Thank you very much for that.
Can I just, as far as maternity and radiology is concerned, we do have significant gaps. So maternity has 1.5 FTE midwife short, and we carry a 4 FTE service provision. So that's quite impactful if you think of the numbers. And our sonographer, we've built the service up to a 4-day service. Annie Polton, you'll remember her, Sharon, and she isn't actually carrying best of health, but returns to work to accommodate a day. Todd Newell is our current sonographer. His wife was looking for a permanent position in the district and couldn't, as a project lead of some kind, I'm sorry, I'm being a little bit unequipped to answer what her job was, but she could not get gainful employment, and he's moving to Australia. He was going to stay. He's local, he's coming back, he's got his own house. So, yes, absolutely. So what I'm trying to say, and I've already talked about advocating for professionals, and that we are still currently I'm still currently fighting that fight. So thank you for imposing again.
I think some of the things that in order for us to be able to get clinicians to come, we also need to look at how we're going to provide accommodation for them. So at times that falls upon us as an organisation to have to provide that accommodation for these for our locums that are coming into our area. So that's probably one of the the huge overheads that we have to carry in order to be able to get our practice, our providers to come into a rural region. In saying what I've said to you about having the current staffing that we have around our clinicians, we always are room for more, because we don't know how long they're going to stay for. We've only got Dr. Robin Sebastian till December, and then we look again for more to come in. Yeah. All right.
Thank you, Cheryl and Robin, for that. Very enlightening. Cheryl, you mentioned fluoride. How soon before we see a benefit in our young ones in Dannevirke since it's been introduced?
Did you introduce it?
Approximately a year ago.
Have you not done any surveys on or asked for any potential data statistics around any improvements from Te Whatu Water?
Up to this stage, no.
No, all right. Well, at this moment, I cannot tell you, but that's the significant stuff that I think would be good for you to find out, is, because going into the next decision making around how you're going to look at the delivery of oral health for this community would absolutely support practices. Our Māori Health team here, I'd worked on, before I left Te Whatu Water, I was working with within the oral health portfolio at looking at getting services, a bus to travel and ensure that rural communities were serviced. We were able to get a bus at Whakapai Hauora over in Palmerston North, and I don't think it's actually been implemented yet. However, we here within our community, it's a huge issue that we need to ensure that our children, in particular our tamariki, are being serviced. Now, we do have a bus that comes to Tararua Health Group, and it's parked. How often does that come, Michelle?
It's doing dental surgery about every 3 months, and that'll have sort of 12, 16 children going in and having teeth removed, and they're only sort of 3 to 5 years old, and they might have significant dental surgery, sometimes a little bit older, and removals, and it's decay. So anything that can be done to improve that, but yeah.
Yeah. So I do say that's. Thank you for that question. I would ask that that be investigated to see the improvement of what that's done for our children of this region, because if it has made, you should be able to get that from Te Whatu Water, right? And then once you've got that information, definitely we should be working together to advocate and to push for services back here. Yeah.
Okay, thanks for that question, Mike, and thank you very, very much to the team for coming and sharing this with us today. I feel like we've filled a big gap that we weren't really sure where things were at, so it's been really, really enlightening and really valuable. So thank you so much, all of you, for your time. It is very much appreciated, and we'll look forward to just following how things go. So all the very best to you all.
Good luck with the elections, team.
Right, so we'll move on to the next speaker. So could we please have a presentation, please, from Te Kiti Hora o Rangitane, Mahalia. Thank you.
Kia ora koutou, ngā mihi nui kia koutou, I tēnei wā, ko Mahalia pai wai tōku ingoa, nō ko nei ahau. Ngā mihi, ko au te pau matua o Te Kiti Hauora o Rangitane. So I'm Mahalia, I'm the General Manager of Te Kiti Hauora o Rangitane. I don't know if I know everybody sitting around the table, so it would be lovely to go around. Obviously I've met some of you, Naomi in particular. But yeah, so, and I don't quite know, I've been here 4 years and the first time I've been invited to this space, so I'm not quite sure what the expectation was. I've presented a short PowerPoint presentation, so I'm hoping that will cover off some of what you want, and then of course there'll be questions, opportunity for you to ask me some questions. So it would be nice to go around and hear who you are.
Peter Johns from Woodville, 5th term councillor.
Kia ora Mahalia, ko Naomi te taku ingoa. I am the Māori ward for the Tamakinui Arua ward, and I'm also one of your employees at Te Kiti Hauora o Rangitane.
Kia ora Mahalia, welcome to council. Ko Irina Piti Weber tuku ingoa, Deputy Mayor.
Thank you. Kia ora, and thank you so much for coming today, Mahalia. It's very much appreciated. So as you know, I'm the chair of this committee, so it's been me that's been communicating with you. This is my last term, so this is my swan song for this committee today, so it's an absolute pleasure to have you here. So thank you.
Mike Long, welcome, thank you.
You've seen me in a number of guises, Mahalia, so welcome. It's lovely to see you here. This is my second term currently, and obviously live locally, so lovely to see you.
Kia ora Mahalia, thank you for coming in. I'm Scott Gilmore, Deputy Chair of this committee.
Okay, is that... So, the PowerPoint presentation, so I gather this is just about, you want to understand a little bit about who we are, what we do. So I've prepared this presentation. So, is this, oh, now I can hear myself. Okay, so the first slide is our board. So we're Rangitane o Tamakinui Arua. What you've got in the front of you there is our charitable trust. So that's the overarching members of our board. You probably know most of them: Mavis, Lorraine, Aaron, Carol, Lisa and Taylor. So our mission is to preserve, protect and enhance the identity, integrity and future aspirations and general wellbeing of ngā hapu o Rangitane iwi and Taurāhere in Tamakinui Arua. And our vision is Rangitane o Tamakinui Arua tino rangatiratanga, self-determination through leadership and participation. So then we have the charitable trust, and then we've separated it out into 3 distinct companies or entities. And so we've got Te Kiti Hauora, which I'm the general manager of. We've got Te Tāhua, which is our economic development and housing. And we've got Te Whare Taiao, which is our cultural and environmental service. I have the next slide, please? Thank you very much. Who's in charge? And so, as you can see, then Cheryl Hoida, so this is our Te Kete Hauora now, that's our board structure, and you can see Cheryl Hoida, the previous speaker, is on our board, and Lorraine, Lisa and Teeny Lowe, most of you might know. And then, so this is just a bit about the organisational structure. So there I am, the General Manager. And then I've got Matua Hinare Kani, who is our practice lead and overall cultural advisor. I've got Leonie Mutu, our service manager, and Mason Elwood, our director of operations. And next slide, please. This is just giving you a really sort of brief kind of overview of who we have. So we've got 56 kaimahi or staff that work for us. We cover the whole of the Tamaki Nui Aroa or Tararua district. We've got our health services, we have our mental health and addiction services, and we've got our social services. And then, of course, a team of administrators to support that work. Next slide, please. Yes, we've got a couple of them. Yes, we have. Now, just on the 10th of July this year, we opened our new clinic. So we're not a general practice, obviously. We're a health and social service. So, but we do have a clinic in which we opened on the 10th of July, and that's on High Street. And then we've got 5 separate locations. We have our main office, which Sharon Ward knows very well, 10 Gordon Street, and then that's where our social services and our administration team sit. We've got Manawarangi behind the Caltech station, which is where our mental health and day activity and alcohol and drug services work from. We have Te Herenga Tangata, which is on the main street in Woodville. So we provide a Heartlands outreach service there. We have Pahiatua, so Hamua Ora is the name of our office out at Pahiatua, and that's our main Heartlands service. So that's about us taking, bringing our services, our main, especially our government services. It's a space and a place where we can bring those services out into the community instead of the community having to go into the town or city for those services. So 5 different offices that we operate from. And of course, you'll all know our Pou Matua, which is Matua Manahi. I'm sure you'll all have met him at some point. He's sitting there on that front photo. So next slide, please. So this is just our health strategy. So Tawake Ro, that has hugely significant significance to us as Rangitane, as an area of a part of this land, a part of where we're from. We have the 4 Pou that we, everything we do, we work from. So Mana Motuhaku, which is self-determination, Kahui Pou, which is relationships, Manuaro is resilience, and Herenga Tangata is engagement. So those are our 4 main principles that we work from. Next slide, please. And this is a little bit about supporting whānau to thrive. So the whole service is driven by whānau voice, and the work that we do are guided by our whānau. So all the services we deliver, it's about identifying what our whānau need, and then supporting and then providing referral pathways or navigating the health system, or a lot of advocacy, our kaimahi work, and to navigate the various health and social services that our whānau need. So next slide, please. This is some of our statistics. So from the year 23-24, those are some of the numbers of people we saw. So 4,645 whānau supported across all of our services for the year ending 24. And you can read that, you can look at that. But just a bit of a snapshot of what we've achieved in the last year. And then some of our work plan for 25, thought that might be of interest to you. Of course, we want to strengthen the integrated approach to supporting. So it's about us all working together. You know, we are that old adage saying, it takes a village to raise a child. Absolutely believe in that. So how do we work more collaboratively together? Yeah, and the next slide, I think we've got a little bit of a presentation for you. If you can turn, is it the sound? Oh, okay. These are just some of just a really a glimpse of some of the stuff that we do. Hey? Not quite the same without the music, but you're getting the fella. So that scooter club was something that came out of just conversations really, and those on scooters saying, well, there's not a lot happening for us. We want to come together. We've got some health and mobility issues, and so our kaimahi just pulled together and supported them to form this group. That's Megan. And, they do a whole lot of different activities. It's about socialising, but creating these opportunities. We've got, on the left there, we've got our Kaumatua celebration at Matariki. So it's about those opportunities where we can talk about health and identify what the issues are that they're facing, and from there we can support them through the different referral pathways, or a lot of our kaumātua, they just want time and people to talk with. Nai's role a lot of the time is coordinating a lot of these events. So that was, I guess, the purpose of that was just to give you a sense of we're a hauora. So it's not just about the physical health or well-being of the person. It's the holistic approach to well-being. So you'll see, and we're about prevention, because we've got secondary primary healthcare services, we've got secondary healthcare services, but a lot of ours is actually working in that prevention space. So where we can pull events together, bring people together in a comfortable, safe environment where they can start to look at what's going on for them, where we can identify what some of the supports are. So there, you would have seen on there a Pepe Order group, which is an amazing group. And I'm expecting that you know a lot about Te Kete Hauora, because Naomi would have shared with you, and you would have the opportunity to talk to her about what we do. But Pepe Order was really born out of a couple of mamas having babies and going, I just need a little bit of support, and I just want other mamas to talk to, and they're new to the community, and so it's growing. And there's about, I don't know how many there'd be.
There'd be about 30 odd mums, and it's continually growing. There's even a bit of a wait list of people who are pregnant, currently pregnant, and just can't wait to have their baby to join the Pepe Order group. Right. And then they've done some amazing stuff, and it was a group of mamas who just wanted to, we just asked them one day to tell us what it is that you want, and then show us what it is that you want, and put the group together, and it's just gotten bigger. They've had mums who come in to show, and they've done market days where each of the mamas have, some of their skills that they've got at home, and then they had a bit of a market day uptown, and that's kind of just thrived, and they've now gone to do their own little markets, the garden markets on a Sunday and stuff. So they're starting to become quite independent in themselves, but also working, finding out what other services are available in town for them and their pepes and their little groups there. It's been quite a success, and the groups that you've been growing, there's the Tāne group, there's the Wahine group, there's the US group for those that are with cancer survivors and those that are going through their cancer journey. There's all these little groups that are helping to tautoko each other and support each other, and it's been quite cool to watch and see, and them saying what it is that they want for themselves and what services they would like to see more of, which we try to accommodate, or we collaborate with other providers, and even with THG we provide more services like that. So it is a great service, and they do really well. Mahali's got some very good kaimahi that are very supportive of this community.
Yes, I do. They've got a fantastic team. And that po, when I talked about rangatiratanga, that's self-determination. So that Pepe Mama group is a real example of it. They own it, they run it, they're fundraising, they're doing things, that becomes their own, and they own it. So yeah, and the Māori, the Tāne group is about male, men aren't that great at talking about their health and what they need, and so what we've created is this safe space for men to come and do things, but it's through the doing that they have the conversations about their health and what they need. So I'm very proud of our team. I'm really excited about the things that we're doing. We are working very closely with THG, so the maternal health services are coming and working out of our clinic on a Wednesday. We will hopefully have the CPT, which is the Comprehensive Primary Health Care Service, which was very, very successful, running out of our clinic one day a week. And it's a shame because we didn't think we would get the funding for that. So that comprehensive primary healthcare team sees the paramedic as well as Kelly, one of our nurses, providing a free service for acute. So whānau can walk in just with whatever's acutely in terms of health, and they can do an immediate assessment and then support the referral pathways after that. Now, that was in a response to the limited amount of GP service we have here, and it's been hugely successful. Whatu Ora basically was going to stop that funding, and they were, and then they had some wash-up fund, so we got it for another year. And we're hoping that, because throughout the whole country, the feedback across is that that's been a very successful initiative. So we will be fighting really hard to ensure that that rolls over again in the following year. And we've lost the kaiawhina role that went with it, and that was a really important part of that, because it was the kaiawhina in our communities working with our whānau that were bringing our whānau to the practice or to the servant. So we've lost that aspect of the funding, but we're going to be fighting to try and get that back. So yeah, that's a little bit about us, and happy to take questions.
Thanks, Mahali. Councillor Sharon.
This is inspirational. Thank you, Mahalia. Having worked alongside in my previous role, it's fantastic to see the depth now of So I have a question, which is what we asked of Cheryl as well. I mean, clearly with them, the focus is on attracting health professionals. How do you get on attracting the right people to do this amazing range of services? Are you struggling, or are you not having any problems? There's a lot of familiar faces that are long lasting there, so you must be doing something right to retain them. But when you do have opportunities like you've just spoken about, how do you get on with the recruitment?
Yeah, it is. It is a challenge, and it's. I think it's about us being very clear about what set of skills we need, and what our value add or our difference is, and then we tailor our recruitment around that. I mean, for an iwi Māori provider, our greatest value is that our kaimahi are from our community, and so you will see a majority of our kaimahi are from this community, and what that brings about is the ability to get into and walk alongside our whānau, particularly those who are not very trusting of services. So we want to have our kaimahi being able to walk that walk with them and be able to access. So that comes with its own challenges, but we've been able to, and we've got some amazing local people. And then I've come in and looked at, we actually need a mix of skill too. So I've looked at what we need, and so we've had to, some of those roles, we've had to recruit for those outside of locally, because we just don't have some of that. But our push, and my push, has always been about how do we build local capability, because we're always services are coming over the hill into the Tararua, and while we're grateful for that, actually we need to do a lot more about building our own capability, and so that's what I've got a very strong stance or position around that. But we have had to access others from other places in order to, while we build those skills. And I think we've just got to do a bit more about how do we work with our schools and identify some of these young ones that want to go into health or the different professions, and how do we set something up, scholarships, and where we can actually capture them at that point, support them along a pathway. Unfortunately, sometimes that means they fly off to other places as well. But that's all part of life. But then how do we kind of make it attractive for them to be home and work? So it is a skill. It is a challenge always. And pay parity is a big issue for us. So for the last couple of years, Whatu Ora has come to the party and given us funding for pay parity, which means we can at least offer a reasonable wage to our registered nurses and our clinical staff, but that's going to come to an end. So again, we'll be back in at that. How do we attract skilled, qualified people when we can't pay them? So it's an ongoing challenge, yeah.
Councillor Mike.
Through you, Chair. Thanks very much, Mahalia, for that. I think you've just answered my question. You are involved in schools.
We are if we're invited into. We don't have any educational contracts. Te Te Hauora doesn't, but when our kaimahi are working with our whānau, what we've found, and we've got this happening in Pahiatua at the moment, so we have whānau that are working with us around some health and social matters, and what we find is when we go into the homes, we've got young people, rangatahi, who are disengaged in schools. So we work in that context. We work with the whānau, and one of their dreams or their moemoeā or their aspiration or their goal and their plan is, how do I get my children back into school? So then we become involved in that regard. We navigate, we support and advocate and help the whānau sort of work towards getting that. But we don't have it. We don't have any educational contracts. We're not in there, but we do work in that regard. My point was we should probably be looking at, as a community, how do we set up some of these scholarship opportunities and identify young people. You know, look at the skill capability we've got and the local capability we want to grow, and how do we work together with schools, with providers, with health, around setting up and growing our own workforce capability here locally.
Thank you for that, Mahalia. So Councillor Scott, Mayor Tracy and I more formally have been involved with the Tararua College discussions around rangatahi being excluded from school. So it's really good to hear you actually mention that. So I'm sure that Scott and Mayor Tracy will carry on with that group. Are there any further questions?
I'm saying something because Mahali is right in that we try, but what Tiki Te Hauora also does is allow for us kaumahi to develop ourselves within the space or have aspirations to try something else. If we like to look at, we feel as though we want to work in the mental health space, they allow for us to also do our own moi moia in that space to extend ourselves in that space. So she not only does try and reach out to external, but she also tries to help grow within.
Thanks for that, Naoma. I think we'll wrap this up now. Thank you so much, Mahalia. It's been really enlightening, and this is the last of our little program of bringing in our health providers to talk to council so that we're all on the same page and we know where everybody's at now that we seem to have these other branches coming from all directions, which is really, really exciting. So,
do you plan to do more of this? Because I do think it's a great opportunity for us to come in and share, or is this a one-off?
Well, no, we've always done this within this committee, but this committee will cease to exist. The government has now taken away the 4 wellbeings again. So we've been in, we've been out, we've been in, we've been out. So this committee won't continue, but there's no reason why that can't be done in an open forum at a council meeting.
Right.
So just, it's taken a while to get through all of the providers, but we've got there, which has been really, really helpful.
Okay.
So definitely, thank you.
Okay, and good luck to everybody as well. Thank you.
Thanks, Mahalia. Okay, so I'll just whip quickly through the formalities of the meeting, which won't take a few minutes. Are there any notifications of items not on the agenda? There being none. Declarations of conflicts of interest? No. And we'll go through the confirmation of the last set of minutes, please. Could we go page 5, page 6, page 7, page 8, and page 9. Thank you. Moved Councillor Scott, seconded Councillor Peter. All those in favour, please say aye. Against, carried. Sorry, my voice is getting pretty raspy. However, that's right. We'll carry on now, and we'll like to call forward, please, Sport Tararua's 12-month report to council, please. And sorry that, you've had to wait quite a while, but I'm sure it'll be really worth waiting for.
Kia ora, ko Kelly Shanks tukunga, he mana hotu kia matatoa. So I am Kelly Shanks, the CEO of Sport 102. Kia ora.
Kia ora, I'm Raylene, the Tararua Community Connector.
And kia ora, I'm Carl, I'm the General Manager at Sport 102 as well. And I'd also like to put an apologies in for Sam Jones, who was here. She's had to shoot off and get her kids, I think it was, from school. She is our Healthy Active Learning Coordinator here based in the Tararua. So she's from Dannevirke, so that's talking about, as that previous speaker was talking about, was employing locals. So it's something that we're sort of really focusing on and trying to build our team across over here in the Tararua.
Thank you. I think the best way to do this is to take the report as having been read and call for any questions. Is that okay with you? Or would you?
Alison, sorry, I've just got a presentation. Is that all right?
Yeah, sure.
It'll take about five minutes. Cool. Thank you. So I'll just click the slide.
So the four up there are the agreed outcomes, and then I'll talk about the four agreed outcomes. If you just go to the next slide, sorry. So the Terra district exceeds the national average for physical activity. So we are proud to say that the district does exceed the national average for participation in physical activity, and includes among groups that are typically less active. So some of the things that we have done in the last 12 months is the Terra Sports Awards. This event brought the community together, celebrated athletes, coaches, clubs, volunteers who are making a real difference in our community. Stories like David Buick and his resilience, how he came back from his injury to be at the top of his game, was one of those things that the district should be really, really proud of. Another one was Terra Seven-Side Tournament, which is an annual event. We've just actually held the 14th one, last week. So another great success there. Terra Ripper Tournament, that's the picture up the top in the stadium. That was supposed to be outside, but the weather was absolutely terrible. And this is co-designed with Manawatu Rugby. So we work together with them and bring that one for all schools in the district. The Terra Duathlon, which is the one down the bottom, we had, it was a new event. I was approached by the principal at Paitoa School to see whether we could do a triathlon in our region. Unfortunately, we did organise that, but the weather was absolutely terrible. So we changed it to another couple of weeks later, and we ended up having a duathlon. And we had about over 50 kids and adults participating, and yeah, they had a great time. I'll just get it. Sorry. The next one is the community understands the value of the benefits of play. So there's a play trailer that we have for the community. It's free, mobile, and has been booked across schools in the community over the last 12 months. And this resource removes barriers for tamariki and all abilities, or everyone can use it. There's stuff in there, resources in there that benefits everyone, and it's free. We also had parent play coach workshop, where we brought in Sport Manawatu staff delivered on how to help parents and coaches better connect with tamariki. And these sessions focused on creating a supportive, safe and confidence-building environment. And then we had an untamed play hui, which is a regional hui that was held in Palmerston North, and we did have one representative from Terra District Council staff member come along to that as well. Next slide. Everyone is encouraged to be active in sport and recreation facilities across the district. So the coaching and refereeing, where there were 30 students from Terra and Danny Vick High School that came over to coaching development refereeing session in Palmerston North. And then down the bottom, the photos are of the secondary school awards. Terra had the winner of the official of the year, Liam Brown, for refereeing rugby, and we also had the official female of the year, Jasmine Dean, who lives in Woodville. So she officiates in basketball. So that's pretty amazing. And then we had Genevieve High School. They were a finalist in the teams. Yeah. And we also have the green prescription and the Tararua run out of Irina's gym. And hopefully we'll be getting that back up running in Paitoa as well in the next few months. Next one. Y-Space Triathlon. So that was an event that was potentially going to be cancelled. They needed money for the traffic management plan. We came up with some Te Manawa funding for them. They were able to offer that event for free, and they had 96 participants in that. The Rural Travel Fund is still heavily overprescribed, and we are working with with a funder trying to get a proposal together to see whether we can get more money into this community for to help our rangatahi get to sports events. Te Manawa funding, we've had 69,000 given out in grants to the Te Arua from that fund. Then another thing we've done is the Te Arua College Community Colour Run. So that was to the health and wellbeing students, leaders from the college approached me and asked if I could help them organise a colour run as part of one of their activities, and then we opened it up to the community. Unfortunately, the weather wasn't that great again. I know it is me. And we had probably 250 people there though, even though it was horrendous. 150 students and then 100 from the community came along, and they just absolutely loved it. They had a great time. And then the last slide.
You can bounce on through.
Yeah, sorry. It's just upcoming events. So we've got the secondary school sports awards, rural cluster days. So that's meeting at, I think it's Kumaroa School. We're doing that one. Flag football out at Pongaroa School. Tupelo Sports Day, which is held at Huia Range and organised by myself and Sam, who's a healthy active learning staff member. The junior development darts with Ngāti Kahunu that has started. That started the first week in July, and that's proving really, really popular. Pongaroa Bushwork, working with the community out there on a Te Manawa application. Just letting you know, the Te Manawa Fund is open. That opened on the 4th of August and closes, I think it's the 29th of August, for anyone you know of any groups that are wanting to apply for some funding. We've got the Titanga program at risk youth at Te Arua College, so we're going there every Friday and in the morning and work with youth that have been identified at risk, and we've held boxing sessions, taekwondo, gym sessions, weights room, and yeah, they're doing really, really well, really, really well. And looking at a community event for Dannevirke, it's next on the list. Pop-up plays, so we've held a few of those recently. Ikirahuna, Woodville, Paita and Dannevirke. Seven-a-side tournament we've just held, and then we're 2026 Sports Awards in March. Yeah.
Just while we're on that slide through you, Chair Allison, the Pongaroa Bushwalk, what activity is that?
So there's a bushwalk across the road from the school.
Oh,
and
that one.
Yes.
Okay.
Yes. So the community have been clearing it. They're working with the schools, working with Pongaroa Way to Go, and the school and the Puketoi to Pacifica catchment group and Enviro schools. So there's about 5 groups involved. And
fantastic collaboration, really.
It is, yeah. So yeah, I'm just waiting for them to get back to me with their funding application. Yeah. And then yeah, do that. And next slide. And I'll let Kelly talk about this one.
Or I think Naomi's
just
got a
ask
question.
the question at the last slide. That two tangata at-risk youth, is that only for the students at Tararua College?
Yes, correct.
So not any other students outside Tararua College?
No, just for the ones at Te Arua College.
That are at risk? Just the ones?
So it's for the alt ed kids and the ones that have been identified at risk at Te Arua College. Yeah. So unfortunately, we can't. The excluded children aren't allowed back on at the property at Te Arua College. Yeah.
So did Tararua College apply for that funding, or was that a Manawa?
Te Arua College did, yeah. I am also working with the Marae, with Catherine Raro, and I'm working on Thursdays. I go to them, to the excluded students. Yeah.
Recently, we were very privileged to win an award alongside Te Pai o Rangaorohini o Tararua for He o Rangapotama for the New Zealand Sport and Recreation Awards last month. And that is a programme in regards to the Iwi Māori Partnership Board, which of course Cheryl is part of. I applied and were successful in regards to He o Rangapotama funding, which is self-determination around for Māori, by Māori in regards to physical activity. We were very privileged around being asked to help support in that space by the Iwi Māori Partnership Board. So we had Pariana who came along and supported in that space in partnership with Te Pai and were acknowledged at the awards. The really great thing about that is when we originally started working in partnership with the Iwi Māori Partnership Board, they only had 1.2 staff member FTE in that space. They have now built their capacity and capability in that space to have over 6 staff members, and so they are able to now carry that programme, and so we have handed back in that space and work in partnership in regards to being on the funding panel and working in partnership with them around that, but they are able to now carry forward with that programme themselves, which is fantastic. So just a little background on that one. What's the next one? I will add $26,000 of that funding because it was about giving the money back to the community to be able to, for the community to be able to run their own initiatives in a way that they wanted to. So $26,000 of that funding came back into the Tararua community for those projects. Online gambling bill. Firstly, I will say about that no, we do not promote gambling. We do not think it's a good thing, and we fully understand what harm it does do. So I just want to give you an update in regards to, which I'm sure you're all over already, but the government is legalising or trying to legalise the current illegal online casino market. In doing so, it is dismissing the 50-year principle that gambling profits are shared with the community. So there's quite a different take on this. The challenge that our community face in regards to that is, which is a sad state in regards to that most sport and community groups and schools have to rely on gaming funding back into the community, which is a shame. It shouldn't be that way, but that's a whole systemic challenge that we can't change just right now, but we'll be advocating for. Anyway, so by the profits going overseas or not coming back into the community, that is going to have a substantive impact in regards to community sport, schools and community organisations that do actually apply for gaming for funding. There is a national movement around putting submissions into that, which are due in the 17th of August. So we have supported our community by giving them all the information and templates if they would like to submit, so that they are fully and well informed in regards to choosing to submit to that process or not and making informed decisions. So that is what that congratulations, on the Howard. That's very exciting. Drove over there today. It was great. And it was great to see so many people actually walking and biking as we're coming over there. I've just signed up to Rotorua Suffer anyway, which is in December. And I was like, this is perfect training ground. So I do very much plan to run over and back there myself. And it'll be a good challenge. I look forward to that for sure. I'd also like to just taitoko Halia and Te Kiti Haora and the great work that they do, and we're pleased that some of the Te Manua funding, for example, went along to support their Wiru o Marae, which is a great event that they run there too. So, just really encourage the community around the Te Manua funding and the great good it can do in regards to bringing aspirations to life for the community, because it is about building capability of the community so that the great things happen in the community, for the community, by the community, because, you guys have all the ideas, to be fair. So,
we do have video as well from the sharing evening that was at Hopero. If there's no sound, then it's not really worth playing, and I don't know if it's going to play. Okay, so no, we won't worry about it then. But it was a cool initiative.
Tara College were involved,
You were at sharing evening? No? That's right. Yeah. Yeah. So we're just going to show that.
I was just going to say that. I've asked Simone if she'll send that whole presentation out to everybody so that everybody can see it on their own devices. Thank you.
Thanks very much, Chair Alison, and team. Thanks very much for another good report. I always look forward to reading the Sport Manawatu, Sport Tararua reports. One thing I just wanted to point out in this one is reports are really great, but often the evidence, of the success of the work is from the things that you hear on the ground, from the sports clubs, from the schools and others, and more of a comment, Madam Chair, rather than a question. The feedback that I've been hearing, particularly recently, has been incredible. The amount of support, the type of engagement that these groups have been having from Raylene has been absolutely exceptional. So I want to pass on that thanks from community members that have mentioned that directly to me. When I'm out and about, I see Raylene and I see the Sport Manawatu car frequently around the place, and often if it's going into a meeting and Raylene's in there looking at finding a solution, and I'm really glad to see the Tararua College example listed in there. It doesn't do justice to the work that Raylene's done, so I just wanted to add that in there because great to have it in the report, but some of the things I'm hearing are very, very impressive. So Raylene, thank you for what you're doing for our community.
Thank you.
Thanks, Councillor Scott. Councillor Mike.
Through you, Chair. Just a query. Junior darts. It's just that when I play darts, I lose my fitness and put on weight. So, what's the area around that?
So they're currently doing holding this in the St Joseph's Hall in Dannyburg. Yeah, and they're loving it. Got 4-year-old kids, tamariki, playing. They're amazing. Yeah, that's really, really good. Yeah.
Councillor Erina.
I'll just comment on that because I'm a dart player, but the children, we don't have a junior section, and when we travel away, there's like Wairarapa has a huge junior section, so is Hawke's Bay, where the kids come through, and it teaches the kids really good skills and good maths. They learn quickly how to add and subtract, and aim, and so there's a lot of skills involved in the darts. And I know that Ngāti Nunu's group that they're running at the moment is really popular, and the kids are absolutely loving it. And it's just something different to do as well. You know, and any child can do it. You don't have to be a super athlete to play darts. So, yeah, it's a great initiative, and one that hopefully we can build on to bring a junior team to take to nationals.
Thank you for that.
You're right. Thank you. Are there any further questions or anything further you want to add? Okay, so I'll just say...
Just want to say thank you very much for your support over the last with this training. Elected members, good luck for your re-election, or if you're not standing. But yeah, really thank you for your support and keeping Tararua active. Yeah, without your support we wouldn't be able to do what we do, and Scott wouldn't get the good feedback that Rana gets. So thank you.
Yeah, on behalf of the committee, I'd like to thank you all for the very comprehensive report, and it's really outstanding to see and to hear the comments. I've heard the comments in the community too, Raylene, that you are seen out and about all the time. And, you know, sometimes that's quite hard in a district of our geographical nature where we're so spread out to be able to be fair across everybody. But it seems to me that that's actually working really, really well. So congratulations, and thank you so much for coming, and safe drive home.
Thank
Awesome.
you.
Thank you.
Thank you.
Thank you, Councillor Ward, seconded Councillor Lima. All those in favour, please say aye. Against? Carried. Right, we'll move on to Bush Multisport Trust. You've been very patient, thank you. I just hope you found it interesting anyway.
Very.
Good, excellent.
Sincere apologies, I have to be gone by 3. So.
That's all right. You talk fast, Jared.
Yeah.
So we have Jared Brock.
Yeah.
Jared Brock and Bex Brown with us, so welcome.
Kia ora. Tēnā koutou, Mayor, Chair and our councillors. Thank you for having the opportunity for us to speak here today on behalf of the Bush Multisport Trust Board and staff. I'm Bex Brown and I'm the Facility Manager here at BMST. You have received our report, so I would like to take it as read. We won't worry about the presentation, that's fine, because it's this. Yeah, no, that's fine. I guess probably the biggest things for us in the last 12 months has been around our community growth and our facility utilisation. So we've seen an increase in over 1,000 hours in the last 12 months. This is due to our connection with Sport Manawatu and Sport Tararua, the schools, the college, and also probably in external relationships with the likes of Manawatu Rugby and Wairarapa Bush Rugby, and being a central place for a lot of those events. So that's been really cool for us. Probably the next biggest thing for us would be our focus on improving our infrastructure. We finally next week are having the last of our dividing curtain being installed inside the stadium. So the beam went up nearly 12 months ago, and November, and so the curtain itself is being installed next week, so that again is going to increase our utilisation, so we'll be able to have multiple events in our stadium as well, and so we're really looking forward to that. Probably our biggest project moving forward be the replacement of our turf over the road. So we will be looking to seek council support and funding partnerships to progress that in the near future. Again, we're very appreciative of the funding that we do get from Tararua District Council, and we also have contributions from Trust House, Bush Rugby Park and others. And we would like to emphasise your investment into our facilities is huge for us in our operational needs, especially when we're providing facilities, etc., to the community and the wider community. We've had new sponsorship come on board as well, so that was a big thing for us in the last 12 months as well. Probably one of the last things is just our local partnerships with Sport Manawatu and Tararua Community Connector. As you've seen, a lot of their work is centred around our facilities as well. So it's really important to us to have a good connection with them, and we're forever grateful. So thank you to Kelly and her team, and to Raylene as well. And just being able to provide some awesome facilities. As you can see, the 7-a-side tournament is a huge day for us, with over 700 kids from around Tararua, and getting them to be coming in and playing with students, against students like-minded, has been huge, and just the feedback that we're getting about our facilities is outstanding, so it's really good. Probably just one last mention is just the amount of volunteers that we're working with. All our affiliated clubs, they are made up of volunteers. We always make sure that we are showing our appreciation to those volunteers as well. We've extended our services into helping them with the likes of the strategic plans, funding, obviously we are having to work with clubs in relation to constitutions, etc. So we're just offering more of a service to those affiliations as well, which again is enhancing them, it's making them bigger, and you can see that in our events, in our numbers as well. But yeah, again, thank you very much to Tararua District Council for all your support. We deeply appreciate your backing and look forward to working with you in the near future. And just again, a special mention to the outgoing councillors. Thank you for your support and over your time in council. And we hope that you continue to support our facilities in the near future. So thank you.
Thank you, Rebecca. I just want to reiterate Rebecca's comments. Just thank you again very much for the funding we do receive. We're very proud of our facility. We're very proud of how much it is utilised, and the funding is invested very well. I think we've taken some great steps in the recent years to keep improving our facility. If you look nearly 20 years ago, the facility was born into what it was, and we're very proud how we're constantly taking steps to improve that facility. And obviously it is something that very much represents the Southern Ward, but with Raylene and Rebecca and the Sport Manawatu and Sport Tararua group, it is something that has been well utilised by the whole Tararua district in recent times. So that's something, as you can see with our hours increasing in I suppose, a sector that is probably struggling a little bit. It's great to see, and we are very proud of that.
Thank you both very much, and as a person of 50 years, I'm really proud of that facility and all of you who run both the Bush Aquatic Trust and the Bush Multi-Sport Trust. You do an outstanding job for our community, so thank you. Are there any questions? Mike?
Through you, Chair. Bex, you mentioned the turf. I know that will be a concern for the future council, not this one. Could you just enlighten us a bit, please?
So I guess in that we had it assessed late last year, and it is near its end of life. So yeah, we would be seeking some funding to replace that, and hoping that in the long-term plan, the turf is still part of that in there for the new council. Thank you.
Councillor Johns.
Chair Allison, would the intention be to replace the whole lot, or, I mean, presumably some parts of it are as good as today, they'll put down, other parts are torn to shreds.
So yeah, so the top of the turf in itself looks okay, and our caretakers do an amazing job at maintaining it. It's actually what's underneath is where the issues are, and probably given the amount of rainfall we have as well, our gutters aren't probably big enough to compact all the rain. It is a dry turf, it's not a water-based turf as well, so the water tends to sit on it, hence the drainage as well. So
it could be rolled up and then fix the sub-base and then roll it back again?
Yeah, it's also got I suppose a bit of a mould issue as well, Peter, and that's something that we've been fighting a lot, and it is to do with the base. The other thing is it's only supposed to have a 10-year life originally. We're at year 15, I believe. So it has done incredibly well and been maintained by our caretakers. And it is all surface playing turf. Multi-use from a hockey perspective. They'd love to have a water-based turf, but just to suit, obviously we have netball, tennis. It's a very well utilised turf, so we have to kind of cater for all those needs. And that obviously does cause it to wear a bit. Well, it hasn't, but it does cause it to wear a bit quicker than we would like.
Thank you. Are there any further questions? I'd like to say thank you so much for coming through today, and I'm sorry you had to wait so long to present, but it was really worth waiting for. So it's just always really good to hear your annual reports.
Thank you so much for having us.
Safe drive home.
Thank you.
Thank you. Through recommendation. Okay. Oh, sorry. Councillor Erina has moved the recommendation, seconded by Councillor Naoma. All those in favour, please say aye. Against? Carried. Thank you. Councillor Sharon.
Because I didn't want to ask the question when they were in the room. I don't know if through you, Carter or Tracy, I see Peter's gone. I saw the length of tenure of the Sport Manawatu contract has come to an end.
Oh, is it?
It's 5 years there. Is that something that we plan to renew? Nodding. I don't know whether that's a yes or a no, or does anyone know?
Yes, so that's through you, Chair Alison. It has been renewed, signed by the CE. So it's been renewed. Yes. Yes.
Right, we'll move on to the management report. Thanks, Carter.
Through you, Chair Franklin. So the first management report is the communications management report. It will be presented by Anna in the absence of Carsten. So we'll take the report as read, but happy to take any questions. Thank you.
Welcome to the table.
Thank you for having me. Hello, everyone. Like Carter said, take this report as read. Obviously, we've been pretty busy this year, but with consultations and all of that jazz, and we've been doing quite a bit of campaigning, te ahua tūranga and dog registration, local elections, obviously, etc., etc. Any questions?
One, Chair Allison. Page 71, you make reference to Godfrey Monument restoration at Mangatanoka. What is that?
I don't have that up on me at the moment, sorry.
That's facilities. Yeah. We're only doing comms.
Oh, am I through a bit ahead of you?
Yeah.
My apologies.
No, that's fine.
Through you, thank you for your report. Have you seen there's more interest in our website with the up and coming elections?
I don't know the data on that. We can have a look at the analytics, but not 100% sure. I have got the website visitors here. It's actually down since the period prior, but that's not indicative of anything in particular. Yeah, exactly. The only time we really see a huge spike in views to our website is when there's a civil defence emergency, and otherwise it's usually pretty steady.
Just a quick comment through you, Chair Allison. Thank you. I do appreciate in chart 4, the top content by views, because that just kind of sets the scene about what people are interested in. What's the one on the left, the top left?
Top left, that is, I'm not sure why that's just one of the photos, but there were multiple photos in the post.
Whipple sculpture around the road.
Yeah.
Yeah, okay. And is this appropriate to ask about the comms when it comes to the information centre and the transition we've made, or is that for another spot? How's that going? How have we...
In terms of...
The transition of relocating the Dannyburg Information Centre?
We haven't heard anything out in the public as such lately. Obviously, there was a lot when it was happening, but that seems to, from my knowledge, died down a little bit. I know that those services are being used, but yeah, I'm not sure. Carter, do you have anything to add to it?
Thank you. Through you, Chair Franklin. From a communications perspective, it has died down. From a integration services perspective, there is a report. The third report is about integrated services. Yes, but overall, it's progressing well. I suppose the community are getting used to the idea of, what services are being provided through TDC, and yeah, we really haven't had any issues so far. Thank you.
Thank you, Chair Franklin. I just wanted to comment, just to say that it's been really good that the posts lately, especially with elections, and I don't know if that had something to do with how many candidates we got, but the posts have been quite different this time around. I don't know what you guys, whether you've done a different course or something like the ideas you've been putting up on Facebook make you kind of read this Facebook again. Like, sometimes you're like, oh, I'll just flick past. But because they're quite different at the moment, and some different ideas, and you guys are doing a really good job, so it's great to see. Thank you.
No, thank you for that. I think I've got to give credit to Kimberly for that. She's been focusing on the local elections as part of her comms portfolio, and yeah, she's been putting a lot of time and effort into it, and yeah, she's been doing a really good job with that. So, and getting really good engagement as well. So, yeah. Yeah. Absolutely. Yeah. 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 Cool, thank you. Thank you.
Thank you. Through you, Chair Franklin. The next report is the facilities report presented by Fontaine. Thank you. Again, we take the report as read. Any questions, please do ask. Thank you.
Through you, Chair Ellison. Good afternoon, Fontaine. Page 71, Godfrey Monument Restoration. What is that?
So there's a monument in the Mangatanoka cemetery there that had some restoration work done. It was this is a project that was done with Kate and a group there. So that particular monument was nominated for through the New Zealand Masters Monumental Masons Association for further work. So they're going to come down and have a look at the cemetery and see what other work can be done down there to restore some of those monuments. Yeah. Yeah. So there's a bit more information that needs to come back for us to understand fully what that is, but it did look like it would probably be a public event, maybe. Yeah. So we're just waiting for that to come through.
Thanks very much, Chair Ellison. Just wanted to jump to page 77, and sorry, hi Fontaine, thanks for your report. Under swimming pools, great to see some of the actions being taken following the section 17A. As I was reading through, I was giving some thought to the extra requirements that we need to put on to some of these volunteer committees contractually, and completely understand why. But is there any support that council is giving to these committees, or any extra funding that goes along with additional reporting requirements for them?
So I'm assuming you're talking about the compliance side of reporting that we require. The support that council will give is through PoolSafe. So we've paid for the subscription for PoolSafe. This coming season will be our learn what to do. So PoolSafe are going to come in, they're going to work with each of our operators, show them what needs to happen, when it needs to happen in order for us to maintain compliance in that space. And then give them the tools that they need to carry on their own. So annually there will be a subscription that we pay for PoolSafe, and pretty much that is going to be all that they need to report on. So it's meeting our compliance obligations when working with aquatic facilities. Yep.
Thank you very much, Fontaine. Has there been good buy-in from the different swimming pool committees that are running the pools? I mean, this stuff's really important to get that compliance side right. I'm just wanting to make sure that we're getting the buy-in that we might need.
So with the initial engagements that I had with each operator, we spoke about working together to make sure that, it's a us process that needs to happen, and the focus is on making sure that we're legally compliant in our operations. So bringing in PoolSafe will help us to meet that obligation. I haven't worked with PoolSafe myself, but this year is going to be our learning year. So we get a pass this year to get our ducks in a row, to understand what that process is. We know what the criteria is, so that's already been given to us, so we can already have a look at those things. That's been shared with each operator as well. But I suppose it's new coming in, but this will be a learning journey that we will do together.
Councillor Peter.
Thanks, Chair Ellison. On page 72, everybody, Fontaine, significant trees. They're listed in the current district plan. I know there was brief discussion when we under the new district plan, but I wasn't aware that any necessary decision had been made as to which trees are included and or eliminated or added to. Can we have an update on that, please?
So at the last meeting, you'd asked for the difference between what a tree register for the facilities team would look like in comparison to what the significance tree or the notable tree register that is listed in our district plan. With the notable tree register, so as part of our district plan, there is a process. It's a bit like heritage buildings. They go through a process. They go through an application process. They can be nominated. They go through that assessment, and then they get approved and added to the notable tree register. In order for any repairs and maintenance to be done on those particular trees, they would need to go through a resource consent. We're not looking to do that. We're looking at an operational level tree register, which will provide an asset management plan for that as well. So it helps us to manage our trees more efficiently, identify the higher risk ones that need to be attended to, so that resources are directed where they are most needed and a lot sooner than where we've been heading in the past. So.
Thanks for that. But a lot of these trees they're on private property. Not sure how they got there in the first place, or whether they're justified in being there. Or if they're still there in some instances, do we review that list?
So I suppose if you're talking about the notable tree register, then that's done as part of the district plan. Yeah, significant trees. Yeah. So anybody, like a heritage building, anybody can nominate and apply for their tree on their property to be listed as a notable tree. And that's the process that they go through before being accepted and added to the register. What we don't know is we don't know if they are all still standing. I suppose that would have been part of the district plan process.
A previous abode that I lived at for many years had about 8 trees that are on the list on the one property. and I have no idea who put them on. It wouldn't have been the owner of the property, it'd be somebody cycling past, I suspect.
So this work that we plan to do for a tree register with an asset management plan for them will give us all of that information and all the locations identified. So we're specific about the actual species, the level of risk that it poses on the community, and all their locations and data that we need, and then plan it in for any works that needs to be done. Trees will only really, like, as you'll know, once you plant one, it's going to need a bit of care to get going, and then it doesn't need any care. And then it needs, later on down the track, it's going to need, you know, some delimbing and trimming up and all the rest of it, and then it doesn't need anything. But what we don't have is we know we have a lot of trees, and we know that it's causing a bit of grief at the moment, but what we want to be able to do is we want to have a good plan in place that helps us to get through it all, and make sure that we've got really good data to help us with that too.
Sorry, thank you, Councillor Peter. Your comment made me think, and we're probably the only ones in the room that would remember little Johnny Appleseed, who was a American pioneer who went across America planting apple trees everywhere he went. John Chapman, I think his name was. So, yeah, the Councillor Sharon.
Just a quick question through you, Chair Alison. So, although it's going to be a work in progress, is what you're saying, Fontaine, in terms of getting that asset list up and running, is the opportunity that, you know, the Akatio Community Centre provided you with to get approval for that Norfolk pine, is that part of the process you're talking about, or is that a completely separate? No,
that's completely separate.
Okay.
That's a separate application altogether. What we're talking about is what council's trees and what we're responsible for.
Ask a question if I may too. There is another tree in the Main Street of Pahia tour that has been identified by the original arborist who looked at the beech tree. It has already lost a section, and part of the last sort of 2/3 of it is dead. And he said he'd already cleared away some big branches that had come down in a windy night. So how do I go about alerting someone to check that?
CRMs through the Anti-NOAT would be great.
Okay, I'll do that. I'll take some photos. Thank you.
I would just like to make one comment with regards to Sports Manawatu. They are doing a fantastic job in connecting in with lots of variety of groups in our community. When you, Councillor Chase, commented about the Tararua College and their the alternative education, so we're looking at who's falling through the gaps here, because we know students are at schools, they're at high school, but there's a heap of them that aren't. We still have young people that are, you know, they're homeschooled too, so they miss out. There's that gap there, so they've been driving towards meeting that. One of the groups in Dannyburg that they'll have reached out to is the YMCA as well. Yeah.
Thank you. Sorry, Fontaine, thank you very much for your report.
Thank you. Our last report is the customer engagement, which is the amalgamation of the customer services, libraries and visitor information. I'm happy to take any of your questions. I'll take the report as read. Thank you.
Thanks very much, Chair Alison, and thanks for the update on this. Just wondering though, if we could just have a little bit more narrative on how things have been tracking. The cross-training in particular, is that, are we comfortable with where that's at? I know that there's been encouragingly some hour changes or some time changes to some of our sites. So from your perspective, are you comfortable with how this project is tracking and moving towards completion?
Through you, Chair Franklin, from our discussions at ELT, the group manager, Sandy Lowe, provides updates on a regular basis. It is going according to plan. The training is tracking well, but just bear in mind that it is going to take a bit of time. So what I can update you on is the recruitment of the customer engagement manager, who started last week, I believe. And with that, we'll also have a coordinator, and they're working through the training program and working through how to amalgamate these services. It may take a bit of time, but it's definitely going well according to the update we received from the group manager. Thank you. If you'd like any particular information or report, I can ask the group manager to provide maybe a summary update to you all. Okay.
Right, to move on. Excuse me, sorry. Where am I at? I've lost my page. Is that the final part of your report? Okay, could somebody please move? Thank you, Councillor Scott. Moved Councillor Scott. Second, and Councillor Erina. All those in favour, please say aye. Aye. Against. Carried.
Just a comment, Chair Ellison, I do like the way these reports are presented. Doing well.
Yeah, the right level.
Yes.
Okay, so that pretty much covers off the agenda, with the exception of the valedictory address. I was a little taken aback when that kind of appeared on the agenda, and I thought, I'm not finishing today unless you're throwing me out. So what I decided to do was, given that this is the final community development and wellbeing meeting, and I think that will be permanent, I've just written a small piece that I'd like to share with you all about the journey that we've been on with this committee. It's been a great journey, but when the government comes in and takes away the well-being, we've got to be mindful of sticking to our knitting and sticking to core business. So I'd like to address Mayor Tracy, the councillors and staff. Thank you for the opportunity to speak about a committee that has played a role in shaping the kind of community we all strive to serve. As councillors, we are often focused on the infrastructure that keeps the district running: roads, rates, planning, the three waters, etc. However, we also know that a thriving, resilient community depends just as much on social infrastructure that supports people's health, safety, inclusion and quality of life. The Community Development and Wellbeing Meeting Committee was established in order to ensure that we did think and look beyond the basics, those things that are considered by central government to be core council business. This committee has managed to provide critical insight to council on a broad range of areas that impact the daily lives of our residents, and I've included in those areas our health and wellbeing, community safety, access to education and services, equity and inclusion, support for youth, families, older adults and vulnerable populations, cultural and recreational development, mental health and social connection. What has made this committee relevant is that it acts as a strategic connector to council, helping to ensure that local insight and understanding of things that our communities need. It brings together a community stakeholders, local organisations and subject matter experts to inform council's decisions with a diversity of perspectives. And I think I take this series of health presentations that we've had really sit beautifully under that. My key focus as the chair in this area has been our health providers. It's been an absolute pleasure to have had representatives of all of our health providers come and present to this committee. In this way, the committee functioned as both a listening post and a leadership forum. The goal for me was to monitor emerging trends and gaps in our local health services following the government's removal of the council's role in locality planning. The Tararua Health and Wellbeing Governance Group, set up by this council, worked extremely hard under the chairmanship of our passionate health guru, Sharon, to create what has been described as a fine example of a locality plan that took into account specifically a tailored approach to improving health services to the people of our district. Just as the government shifted the focus away from local councils having involvement initiatives such as locality planning for Tararua, It has now taken away the four well-beings as councils are repeatedly reminded that we must stick to our core business. I ask, what is the point of a core business without the consideration of the well-being of our communities? I will never quite understand the rationale behind this. The four well-beings are social, economic, environmental and cultural, have been in and out of favour as many times as governments have changed since this approach was enshrined in the Local Government Act in 2002. Successive Labor governments considered the four well-beings core to local government's role, while National see the four well-beings as being detrimental to the focus of council's core function. In conclusion, this will be the very last ever community development meeting of the Tara District Council. It's back to basics. Personally, I find this very sad for our communities as many successful projects have come and gone throughout those years, from the locality planning to healthcare, mental health and addiction, better communication, connection and healthy living, which included a focus on the healthy home standards, aimed to improve the quality of rental housing by ensuring properties are warmer, drier and healthier for tenants. These truly have all been about our four well-beings. In conclusion, sincere thanks to you all for your support of this committee over those years, and a special thanks to Deputy Chair Scott, who stepped in for me on several occasions, and to Group Manager Carter for her unwavering support and guidance. Thank you. What have I say? So with that, sorry. Pass me a note. Oh, we haven't put Steve in the apologies. It'll be okay to add Steve to the apologies, please. Thank you. Seconded by Emma, thank you. Oh, Councillor Mike.
Did you send an email to Ernie Christensen with my name and all?
To Ernie? Oh, yes, I did. Yes, I did. Yes. It's not part of this meeting. Okay. It's my own personal feelings. It's nothing to do with this meeting.
It's well-being of people in this community.
Okay, I'm going to close the meeting, but I'm going to explain what it was about, and that is that as a Southern Ward councillor of all these years, I personally have experienced and felt the imbalance around the table when we have 3 councillors in the south and we have 6 representatives in the north. And so to have 2 Northern Ward councillors standing in the Southern Ward when we have very good candidates standing from that ward, I feel is a real shame, because all that's going to do, if any of those get elected, is create an even greater feeling of imbalance between north and south. And I know we're a district, but we are elected in those wards, and that's what that was about. That was my own personal conversation with Ernie, okay? And I included you in it because you live in the north as well.
Correct, but I pay rates in the south and the north.
I know that. I know that. I understand that, Mike.
Yeah.
That's enough. I'd like to close the meeting now, please, at 3:17. Thank you.